Hello, how are you? Welcome to a new installment of your Pharmacy Assistant. On this occasion, we would talk about what it is used for and how it is used. So let's take a look.
Hi everyone, how are you? Today, I'm going to talk to you about Lansoprazole. Lansoprazole is a medicine widely used to treat stomach and esophagus problems. If you suffer from heartburn, reflux, or ulcers, this medicine can be a great help. It is also used to prevent ulcers in people who take anti-inflammatory drugs like ibuprofen. And how does it work? Lansoprazole works by decreasing the amount of acid your stomach makes. This allows the stomach and esophagus to heal, relieving pain and discomfort. So how do you take it? Usually, the starting dose is 15 to 30 milligrams once a day, before a meal, preferably in the morning. Afterward, your doctor may adjust the dose according to your needs. It is very important that you do not chew or break the capsule. You have to swallow it whole with water. Like all medicines, Lansoprazole can have side effects. The most common are headache, nausea, and stomach pain. In rare cases, more serious effects, such as allergic reactions or liver problems, can occur. If you notice any unusual side effects, do not hesitate to contact your doctor immediately. In short, Lansoprazole is a very useful tool for treating and preventing stomach and esophagus problems. But remember, you should always follow your doctor's instructions and never self-medicate. Thank you for watching this video. Take good care. See you soon.
If you've made it this far, let us know in the comments why you're using this medicine.